Let's talk active TB medications today.
But before we begin, a quick disclaimer: this is not to replace reliable sources of information. This is just something I prepared for myself while studying. So it's not encompassing and may contain errors. Treatments vary from countries and also changes every so often. This brief overview of the first-line treatment in active TB is based on Canada's Canadian Therapeutic Choices 2017 version, and so it might be out of date by the time you watch this.
So first line for active TB treatments can be broken down into two phases. Phase 1, the intensive phase, and phase 2, the continuation phase. So phase 1, we start off with isoniazid, rifampin, pyrazinamide, plus or minus ethambutol. Isoniazid and rifampin target the bacteria that actively divide in the first few days. Pyrazinamide targets the slow-growing bacteria. As for ethambutol, it is only added if resistant rates to isoniazid is more than 4%. It is important to note that ethambutol is bacteriostatic, while the other agents are bactericidal. So starting off with isoniazid, it is a CYP3A4 inhibitor, so you have to be cautious about drug interactions with the CYPs. Standout adverse effects include hepatotoxicity, drug-induced lupus, increased risk to seizures, neuropathy. Speaking of neuropathy,
This is why vitamin B6 is always prescribed alongside isoniazid at a dose of 25 milligrams per day. Now, continuing on with adverse effects,
it includes gynecomastia and an increase in bilirubin. Going back to hepatotoxicity, it is important to stop isoniazid in patients if their liver function tests, so their LFTs, come back 5 times the upper limit and the patient is asymptomatic, or if their LFTs is 3 times the upper limit and the patient is showing symptoms. As for rifampin, it is a CYP inducer, so it's important to be cautious about CYP drug interactions. Notable adverse effects include the orange discoloration of fluids in the body. So for example, it makes your tears orange. It also causes GI upset, but it is important to note that this medication is actually best absorbed on an empty stomach. Another notable adverse effect is urticaria, so like hives. Now off to pyrazinamide. Like isoniazid, it can cause hepatotoxicity. So once again, it is important to check the patient's LFTs. And if the patient does have liver problems, they might not be the best candidate for this medication. Other patients who might not want to get this medication include those who are over 65 years old and those who are pregnant. Now back to adverse effects. It can cause hyperuricemia, which means there is a risk of gout. And please note that allopurinol, a gout prevention medication, might increase the levels of pyrazinamide and therefore also exacerbate gout. One more thing is that, as you will remember, allopurinol itself, when it is first initiated, it can also increase the risk of acute gout attacks. So you have to be a little bit careful with that as well. Another notable adverse effect is drug fever. Now moving on to ethambutol, adverse effects include SJS, so the rash, and ocular toxicity. Because it can cause red-green color blindness, it is important for patients to get their monthly eye exams. Now as for drug interactions, remember to tell patients to separate ethambutol and aluminum by 4 hours. Now phase 1 medications are taken daily for 2 months. However, daily can mean daily, or it can mean daily for 5 times a week. But each time that they take it in this 5 times a week, it must be an observed dose. By this point, after 2 months, the culture should come back and the results will dictate the duration of phase 2. Now, if the culture is negative, there's no cavitation, and the intensive phase included at least isoniazid, rifampin, and pyrazinamide, because some people can't take pyrazinamide. Then for the continuation phase, the patient would receive isoniazid and rifampin daily for 4 months. So this means that the total duration, so both phase 1 and phase 2, will be a total duration of 6 months. Otherwise, if it's like positive or there's cavitation, then the patient would receive isoniazid and rifampin for 7 months, making the total duration of phase 1 and phase 2 9 months in total. Phase 2 medications are taken daily for 4 to 7 months. So once again, depending on the culture and stuff. But in this case, daily can mean daily, or 3 times a week, with each dose being an observed dose.
and that wraps up this quick overview. Now, once again, this is just surface information about active TB treatments. This is just the first line for it. There are many other cases and scenarios whereby different agents may be used. And so once again, this was made by myself for myself. It is not to replace reliable sources of information.